You're listening to the Luminate series on the Forward Faster podcast, providing bite-sized insights for entrepreneurs in the optics, photonics, and imaging sector.
In this episode of Forward Faster, you'll be hearing about advances in blood pressure monitoring driven by the power of light. Our guest today is Dr. Mohan Thanikachalam of Dynocardia. Dynocardia is a member of the 2021 cohort of the Luminate Startup Accelerator. This is the only accelerator for companies developing new products based on optics, photonics, and imaging. I am Dr. Damon Diehl. I am the Technology Program Manager of Luminate. Well, Mohan, thank you. Great to see you.
I'm good, thank you. Thank you for this opportunity.
It's a pleasure. So I always start off with the question that every startup needs to answer is, what's the problem? What is the problem you're trying to solve and why is it important?
The problem we are trying to solve is the 100-year-old problem, having more accurate and continuous blood pressure measurement. And as you might be familiar with, and most people are familiar with, the way we have been measuring blood pressure for the last 100 years is using cuff-based devices. The issue with them is they are very inaccurate. And even if you manage to measure them accurately, it gives you only a single time measurement, while the blood pressure changes minute by minute. In the couple of minutes we have spoken just now, your blood pressure will change significantly. So that's the problem we're trying to address. Because why blood pressure is important? It is high blood pressure is the number one killer across the globe. It's the number one cause for heart disease. And secondly, almost every critically ill patient in hospital need accurate and continuous blood pressure measurement so that we can manage them well. And thirdly, having looked at blood pressure for the last 100 years, you have no idea what the real world blood pressure is. So there is need for fundamentally a different way of measuring blood pressure so that we can come up with a completely new actionable data for cardiovascular disease prevention. So broadly, these are the reasons why we're doing what we're doing.
So how does your product address these problems?
In the last 100 years, we've come up with certain ways of doing blood pressure measurement. We went to basics of physiology. We've come up with physiologically different way to measure blood pressure. And secondly, we have built a wrist wearable technology that actually can measure blood pressure accurately and as well as continuously.
And I found it really interesting. In fact, I will make sure that we have a video of this because it is astounding the way that it works. It's this imaging method of doing it. You can actually see the pulse happening on the skin. And I found that incredibly interesting. I'm curious, what are the trends in the industry that you are leveraging in order to do this technology? You and I have actually talked about it in the past. So yeah, what is it that's making this possible?
What is making it possible is this, the statement, right? Prevention is better than cure. So what we're trying to address is the overall trend towards how we monitor patient, able to predict disease versus able to act on it once the disease sets in. So, and you could take these principles in hospital, right? The way in hospital, how you monitor patient is you're very reactive. We wait for the blood pressure actually to go down, an acute event to happen, and then we act on it. The better way to do it is able to predict a particular acute event that's happened so that you can actually prevent it. And if you take the same principle, is if you have high blood pressure, is able to predict, what is your risk, accurately risk of stroke and heart attacks. So then you can prevent it. That's called secondary prevention. Or you can actually prevent hypertension. That's the primary prevention. That's where the greatest value comes, even before the chronic disease sets in. So what we are doing is the overall trend in medicine is what you can summarize as saying predictive monitoring.
Yeah, I liked what you said, that the prevention is always cheaper to handle than the cure. So if we switch over to just entrepreneurship in general, I'm curious, what is one thing that you have learned that you think other people ought to know when they are trying to get started?
I come from the Boston MIT ecosystem. The most important thing is define the problem you are actually addressing. And we believe one of the advantages we had, my background is a physician. where I could understand what the issue is, right? What is the clinical problem you're trying to address? And then we went and built the technology to address the problem. The most of the time is the technology actually looking for the problem. So make sure that you are addressing the problem that needs to be addressed, and your technology is the proper fit. I think that is the biggest challenge, and that's what I see all around me.
That's actually something that is worth bringing up, is that you are a real doctor. I'm just a PhD, but you're a real doctor, you're a medical doctor. And that's a perspective that you bring toward this development that I think that's really unique. And it fits with your idea of how important it is to know the problem in advance. A company that is searching for a solution is way better than a company that's searching for a problem as far as success goes.
Right.
Obviously, as a startup, the thing that you need most is money. But what is the second most important thing to move your business forward?
People.
People?
Yes. Ultimately getting the people with the right skill set and also able to fit into the kind of culture you're trying to set in. I think that's the most critical. That's what it doesn't matter, in my professional life as a physician, that's very important. And as well as a business. Ultimately, the team, the people make the biggest difference.
Yeah, in a startup, you can't really afford to make a mistake, right? Everything's so fast, and the money is so tight. I hear what you're saying there. So when you were a kid, you become a doctor, which is what a lot of people are ambitious for. But when you were a kid, what did you want to be when you grew up? Was it a doctor all along?
Yeah, probably yes. Doctor along. It's because I come from a family of doctors. So, and I was exposed to it from the beginning. And particularly, my interest is always being a surgeon. I'm a heart surgeon. So that's what I always wanted to be. And but I've evolved. And I more and more as years have passed, I'm focusing more and more on public health and prevention, and that's what I'm doing. What I'm doing now. So, but to answer your question, yes, I always wanted to be a physician.
So, is there something that has driven that shift for you, as far as moving from being a surgeon to having a broader interest in public health?
Yeah, I do a lot of work in outside the U.S. And particularly Asian countries, particularly Southeast Asia, and what I realized is, the incidence of diabetes and hypertension is rapidly increasing, and it is not, it's almost like a different disease. If you look at in the U.S. where I train, is generally related to obesity, what we call metabolic syndrome, and you get diabetes and hypertension. But you look at some of these populations across the globe, obesity is not the issue. An average BMI of some of the population is just 23. So that's what really got me interested. And if you really need to make a difference, and a large difference and make an impact, is addressing two major causes for cardiovascular disease: diabetes and hypertension. And among these two, hypertension, it's almost every single continent, including Africa, is a major factor for increasing morbidity and mortality.
What are the things that are leading toward hypertension around the world? As you said, United States, you think of obesity as the driving factor. Is there something else that you feel is driving that you can point to?
I'll give you an example, right? We're conducting a 8,000 people population-based study, urban and rural populations, where these are rapidly urbanizing populations. So when you control for all the risk factors, nutrition, right, BMI, and everything else, and when you look at people who living in the urban environment versus in traditional rural environments, their what is called systolic blood pressure is much higher than somebody in the rural areas. When you look at this further, when you look at satellite measures for pollution, and if you look at it, it is significantly higher in rural areas. So one of the take-home messages from the study has been air pollution is one of the factors that's affecting. Stress is one of the factors that is affecting. So we always thought about as traditionally as nutrition and obesity, but I think I've come to believe it's far more multifactorial. And I've more and more come to stress and your environment, particularly pollution, makes a big impact.
That's really interesting. Being an entrepreneur is very stressful. And that's a big concern that I have for people working in entrepreneurship is the level of stress. And because you've got a bit more experience as an entrepreneur, do you have advice to entrepreneurs about how do you minimize the stress in your life while still trying to be successful?
Well, I think I don't think it can compartmentalize in sense, I'm just going to be entrepreneur, I'm going to manage this. That's how you approach life, right? And I have colleagues who are doctors who are very stressed at work, and some people are not. So it is the question of how do you manage your day-to-day living, and how you learn to manage it. I think it's very important. I don't think it's very specific to entrepreneurship. I think it's every aspect of your life, and I think putting some emphasis on that, I think is going to be very important in the future.
So Mohan, this is a little bit off topic, but I'm just curious, what is the craziest innovation that you have seen as an entrepreneur over the years?
I wouldn't say the craziest, the most impactful I have seen which is close to all of our lives now, is the mRNA-based vaccine. Never done before, and having it available to us in a record time and having such a major impact on our lives, I think to me is truly amazing.
Yeah, it's stunning. I was really cynical because it's a coronavirus, right? I said, well, it's like getting a cure for the common cold, which we don't have.
Yeah.
And I wonder, it's amazing the implications of this,
it is.
Right?
And to have that and have that such an impact on our lives now. Do you understand? Imagine if you didn't have the Pfizer vaccine or the Moderna vaccine, right? Imagine where we would be when it comes to COVID-19 now. That is innovation. Do you understand? That is having impact.
Yeah. I totally understand that.
Yeah.
So if you look ahead 5 years, what do you think is going to be possible in your industry? I don't know if you want to talk about point of care or blood pressure, but just in 5 years ahead, what do you think will be possible?
How we actually manage chronic diseases. I think there's a major shift, particularly given the last 1 year of COVID-19. Instead of very clinic-based care, it is going to be more decentralized, home-based care of managing people with chronic diseases like high blood pressure, diabetes, or sleep apnea, or heart failure, and that's where our device will play a major role, where you're able to monitor patients 24/7, and they're able to manage the disease where they live.
That sounds fantastic. Okay, so in 10 words or less, if you wanted to leave our viewers with a thought or an inspiration, what can you say in 10 words or less?
Think big, and if you have the passion for it, you can achieve it.
Well, thank you very much. It's been a pleasure. It always is. I love talking to you.
Same.
And again, thank you to our viewers. If you're watching on YouTube, remember to like and subscribe. You can also find us on iTunes and Spotify. Just search for NextCore Forward Faster. See you next week.